In case presentation number 1, you see a fairly typical situation that might face any mentor, a refusal to comply. In the discussion, I'm hoping that many of you could see the value of trying to simply issue an effective command, followed by some praise if you get begrudging compliance. Usually this helps to get them back on track, and the rest of the evening might go just fine. However, one must be prepared for such encounters and do what one can to respond. When you considered the factors that might contribute to Johnny and Susie's behavior, I'm hoping that you might have considered the following. First, perhaps this is simply a reflection of the child's ADHD symptoms. That is, this might be just an impulsive reaction to the child's internal emotional state. They are disappointed at not doing the fun activity of last time, and this is being channeled into an instantaneous reaction with little thought for the consequences of their behavior. A second possibility is the fact that this is your first evening visit with them. This change in routine may be causing a more negative emotional reaction. Often, children with ADHD do have difficulty adapting to changes in routine. A third possibility is that because this is an evening visit, the child's ADHD medications may have worn off, and this has led to an increased impulsive behavior and negative reactions. This is a common situation for children with ADHD, as this sort of medication does reduce in effectiveness over time and can even have a rebound effect where there are significantly more hyperactive, impulsive, and inattentive behaviors. In the case presentation, you might have noted the parent's obvious exasperation with this child's behavior. Perhaps the child is also carrying over this negative interaction to their interaction with you. We call this a negative emotional spillover or displacement of emotion. This is common in all people. Perhaps this is simply just an immature but normal response to not getting their own way. That is, maybe they just are honestly upset and they are doing something that they aren't doing something that they really enjoyed last time, and that this is their immature way of expressing, "I'm upset with you for not getting my way." If this is the case, I often find that if you correctly and compassionately can reflect the child's feelings, that you might lessen their resistance. Perhaps if you can get them to acknowledge their emotion and have them consider that you might be able to plan such an activity again, then you can offer this as a future choice. Recall that children with ADHD do have difficulty with the idea of delaying gratification or delaying getting what they want. And this child may also have a personality which is a bit anxious, and thus they might have a high perceived need for control of the situation. If so, reflecting their emotion and calmly issuing an effective command, as in Skill 1, or offering a clear and simple choice might work. What is the simple choice here? I should think that this might be, "Johnny, Susie, you have a choice. You can either put on your seatbelt and we can go on a fun outing together, or we can cancel the outing tonight." Wait out 5 seconds, in your head at least, and say, what will your choice be? As you'll see in the next 3 skill videos, you have other options here. I hope that this has been a helpful case presentation to highlight some of the first 3 skills that we have covered so far.